So the first thing I'm going to do, I'm going to knock when I go into a patient's room and introduce myself. I'm going to say to the patient, hi, I am your nurse. My name is Kristen, and I'm going to identify the patient as who she is. And she tells me her name, and I ask her her date of birth, and she tells me her date of birth. And then I also look at her wristband and see that she is in fact who she says she is. And so I say, okay, Alice, well, the doctor has said that the doctor's ordered that I need to do a catheter for you. And I'm going to ask her, and by the way, I would have brought all my supplies in before I did any of this. And but then when I got here, I'd be like, do you understand what a catheter is? And she's going to be like, yes, I've had them my whole life. I'm a pro at them. And I'm like, so you're not worried. But if she was worried, some of the things that she may state would be, is it going to hurt? To which I would reply that it's not going to feel good, and that I'm going to tell her some things that will help while we're doing this whole process to make everything easier. While I'm doing all this, I would have made sure that I have washed my hands when I come into the patient's room. I'm going to wash my hands, and I am going to provide the privacy that she deserves. So I've come in here, I've identified her. I've got all of my equipment except for the gloves that are over here. And we're just shooting the breeze here, me and Alice, because we have a ton of things in common. And, you know, I'm getting real busy with her, so we're going to be comfortable. I will have all my equipment, which would consist of the gloves that I don't need for the sterile, plus the PeriCare that I'm going to provide for her in just a minute, the hand washing, and then also the tray, and the trash. I want to make sure that I have the trash in a spot that I do not have to break my sterile field over. And I really, really wish that this would slide under. Hold on. So I'm going to move the bed up a smidge to where I'm comfortable level. Okay, so I've explained to her everything that we're going to do, and I'm going to realize that she might not like that she's going to be exposed, but I'll try and do this as quickly as possible. First thing I'm going to do is just PeriCare. Throughout this whole process, I'm going to just ask that she keep her legs like this, just so that we don't have anything touching where I'm cleaning. So for just my regular, I will have washed my hands. I'm going to put on gloves, and I am going to use the wet wipes to just provide all PeriCare. This is a good opportunity for me to check and see if there's any problems, and I could ask her at this time if when was the last time she urinated. I could ask her what it was like. I could look at her stomach and feel her stomach to see if she was uncomfortable and had distension in her stomach and a full bladder, and all those things that I would get from asking her on her why it's happening. So now when I am cleaning her, just regular PeriCare, I'm going to go from the front to the back on one side. I'm going to get a different Kleenex or wash and do the other side, front to back. And then I'm going to use one more, and I am going to just spread everything and go right down the middle, front to back. And so now I have gotten that PeriCare all taken care of. I would have changed her chuck and all that stuff if need be. And wouldn't you know, my face itches when I'm not gotten sterile yet, so it's good. So now I'm done with all of this stuff. I'm going to wash my hands again. I've taken off my gloves, but I'm going to wash my hands again because now I'm going to start the real biz. So I'm going to go this over here, get this out of the way, this out of the way, then I'm going to wash my hands again. And I know that this is where it begins. Oh, I'm not supposed to blow on it. I'm not supposed to blow on it. So when I'm opening this, I want to make sure that I keep everything right here because I need to be able to see it at all times. And I will just start like that. Now I'm going to use this later, possibly. Maybe it just depends on how things go for me, if I want to use this as a trash. So at this point, I may set it down here. Okay,
I'm gonna turn your video, sorry.
Okay, so I do not need this, and I'm just gonna drop it because I don't know. I want to. I'm gonna put my sticker over here because I don't need that till very last. And then I'm going to place my tray in a good spot that I can open it, and this is important, very important, away from me. Just touching the edges. Like, I do not want to touch anything other than just the edges. So I'm gonna come over here and do the same thing, making sure I only touch the edges. I don't see the edge of this one. So, and sometimes they have a tendency to pop up, so you just have to work with it and make sure that it doesn't. And you can grab the corners that you've already touched, and that is fine. But see, if I had a bigger belly, I would want to make sure that it didn't touch this, because if it did, it would have broken my sterile field. I am okay to use those edges and slide this over here, okay? I want to make sure that I don't let the patient touch it in any way, shape, or form. So I've got these, and now I'm going to grab my gloves first, and with these, you want to make sure that you still just touch the edge of things, and the outside of this is okay because it's not touching anything from the inside. So now I've come over here and I can grab underneath this. That was really bad. And I would just make sure that that didn't flop back up. I'm gonna glove my dominant hand first by grabbing the cuff, and it's right here. So I'm going to grab it right here. And a good thing to remember is to step back, since once I touch this, if it was to drop, I would have ruined my sterile field and had to start all over. So now I'm going in, and you'll notice I'm not wearing my watch or any rings, and don't want to have anything in the way of that. Now I have one sterile field or sterile gloved hand. With this one, I'm going to tuck it in over here, and I will put this in here. So now I cannot touch anything that's not sterile. The inside of this paper is sterile, and I do not want it in my way anymore, so I'm just going to flick it to the side. Again, I've not let anything out of my vision. So if I would have turned my back to like wipe her nose, I'd have had to start all over. So now I'm going to take the, this is just going to go under her bum, and I want to still just try and keep things away from me as much as possible. And I can, this is always tricky for me, put the shiny side down, criminy, and I'm gonna just tuck this. Now I wanna make sure I haven't touched any other part of her with this, and I'm gonna tuck it underneath her bottom. And I don't need to go too far, it's just to, but see, with this mannequin, it's kinda hard to get in there. Having it touched her legs, it may have broken the sterile field, but with a real patient, I feel like there'd been more cooperation and I would have been able to do that a little bit better. So we're good there. So now I am going to, I don't think this is set up right. I don't think mine is set up right. Okay, so I would want to make sure that if I'm putting this on her next, it wouldn't make sense to me because then I have to use the simulated swab sticks next, and that would get these wet. So I would set this to the side, and I can take this off at this point because I'm sterile. I would set this off to the side. I would take out my swab sticks. With these, you want to make sure that you do not touch anything with the juice, with the moisture, whatever it is. You know what I'm talking about. You know what I'm talking about, don't you, Nurse Kristen? So you're gonna open it with the sticky ends, the sticks up, just because you don't want any of that water to splash onto or the liquid to splash onto that. It would ruin your sterile field. Not because this isn't sterile, but because the material would be absorbing anything that's soaking it in. So a good way to make sure you don't get anything wet that's not supposed to be wet is that you can just kind of take these out, and you may even want to just kind of set them just over here and lay them down so that they don't touch anything that you don't want them to. And at this point, this is where I'm going to be getting most everything that I need ready. I'm not going to use the extra set unless she was really nasty, and then I probably would. I didn't drop that below my sterile field. I kind of got close, so I'd make sure I was watching that. I have another sticker in here that I can kind of move over there out of the way. I like to open up my lube and put it in the tray as well. So you can put the catheter, you can put the jelly on here, but my option is to, I'm going to open this, and I'm pretty sure I needed to do that from the bottom up, but I don't know for sure if it really matters too much. I just want to make sure that I do not touch as much as I need to, but I can take it and stick it right into the lube and leave it for a second while I work on cleaning her. So now this is ready, and I have, make sure that this does not touch anything else. Another thing that I would want to do is get my my syringe ready so that I can insert that to blow up the balloon. I kind of lost track of where I'm at. My mind went somewhere else. Okay, so I'm going to just put this and attach it right there. And I broke my last one because I pushed it too hard. So hopefully that did not anything wrong. Okay, so now is the time that once I touch her, I only have this hand to work with. So I'm going to take my swab sticks and I'm going to clean her, criminy, rewind. I'm gonna fix that part because, yeah, no. I gotta double check if I'm supposed to clean her first and then put on the little V-shaped access hole, or if I should put on the access hole first and then clean her. I'm gonna put on the, I might have just broke sterile field again too. I would have asked the sweet little CNA to come and itch my eyebrow. Why, thank you, CNA. So I've got this. I'm so confused. Okay.
You're doing
so
good.
This is gonna go on here, and I'm just gonna place this on her here, like so. And then I'm going to take my, make sure that this doesn't touch anything that's not necessary. I'm gonna take my swabbies, and I still think I might have had to have done the swabbies beforehand. I've got to double check. Fill on my part. Okay, so I'm going to go down one side and make sure that you spread whatever you need to. See, that's what's got me worried, that thinking I did it wrong. And I'm gonna drop it in the trash, and then I'm gonna go down the other side and drop it in the trash. And all of this has stayed within my vision, so I'm good. And I'm gonna go, I would not have let go. I would not have let go to readjust, but then right down the middle. Sorry, I really wouldn't have let go on a real person. And I just kind of went a little too far right there. So I've still had her spread this whole time. And now I can bring this tray over to the bed and set it down here because I am ready to insert the catheter. And I'm gonna explain to her the things that will make it easier, that I'm gonna try and do it as quickly as possible, but that if she will breathe out, take a deep breath, when she breathes out, I'm gonna go in with the tube. So with this, I've still kept my same hand on that. I'm gonna come over here and I'm gonna just move this over here in between my fingers, and I have got this lubed, And so I am gonna place it right here, and I'm gonna tell her 1, 2, 3, just take a deep breath out, and as she breathes out, I'm going to go in. And with this, you want to make sure that you go in until you'll see urine, and when that happens, you want to advance it about 2 more inches. This lady is plastic, so she's not really allowing me to do that extra 2 inches, if you'll notice, and that's kind of stressing me out, if we're being honest. So now I have it in. I am able to move these hands that I have kept on her labia majora this whole time down to the right next to the meatus, like right next to where we would have entered. And I can hold it there so that when I use this hand to inject the balloon and fill up the balloon, that it's not just gonna pop out. So at this point, I would have made sure that I have checked the doctor's orders. Obviously, at the very beginning, I would have checked the doctor's orders to make sure how much I needed to fill up her balloon with. And so I would just go in with this. And so a good thing to do is to get it in there according to how much you're supposed to have. And so when you're done with that part, you can kind of give it a little tug to make sure it's not going to come out. So you can see I just tugged it, and I'm good now because I am done with my sterile field. So this is where I would be done with that, and I would take her tube out, or well, let's see. I'm going to rip her thing first and clean up all the mess that's around her. And my garbage is full, but that doesn't matter. I just set it. I would take this, I would make sure that I give her room on her thing, and I would tape this to her thigh. I didn't grab tape, but I would have in a real world. I would have grabbed tape and taped it to her leg. And make sure that I gave her enough wiggle room so that if she moved or whatever, it didn't gain on it every single time. So, look at my lovely little CNA has brought me tape. At this point, I probably would take off my gloves because tape and gloves does not work that great. So I would put some tape on this and tape it to her leg. When I do the bag, when I take the bag out, I'm going to label the bag. I'm going to put my name on it, and I'm going to put the date and time that I put it in, and just document everything that I need to about the information on that. And then I'm going to, tape's not working. So pretend this tape worked awesome.
Sorry.
And I have taped it to the patient, and she's like, wow, that seriously was the best cath I've ever had. I didn't feel a thing. You're amazing. And I'm like, I know. I got taught at Snow. So I can remove this. I would have put on gloves again after I taped, washed, gloved again. Let me do that because I'm going to just put on gloves. I'm just going to do it. I'm just going to do it. God, I'm going to hate looking at this back. It's going to be a disaster. I don't care though.
You're doing good.
I would look to see if there was anything abnormal about it. Like if there was blood coming out, I would like note that, all that good stuff. So with this, you want to put this sticker on it and make sure that you attach this to the bed and not to the rails. Attach it to the bed with the sticker, and also never hold it above because gravity will just rock your world, and all of this is just going to go right back into her and cause bigger problems. So then I'm going to say, oh, well, look at all this pee, and conveniently enough, I need a urine sample right now. And because it's been within 30 minutes, I can obtain it from this port right here. So I'm going to use this port right here and a needle to draw out that 30-minute urine, that 30-minute-year-old urine, 30-minute urine. And then I would just squirt it into this and label it. So that's how I would do it if I was doing it from the port. If it's been Nope, hold on. I don't want to grab urine from the bag if it's been over 30 minutes. That's when I'm going to come here. If it's been within 30 minutes, I can get it from the bag. That's what I meant to say. You know better, Kristen. Come on, pull it together, Snow. So now if I want to obtain one from my bag, because it's been within 30 minutes and she's got great urine, it's only 30 minutes old, I can get my little sample cup and come down here. And with this, when I'm doing it from this with the needle, I would definitely make sure that I clamped it, because if you don't, that's not cool. And then anytime you ever clamp this, you make sure you unclamp too. And you can just do that there. Always make sure you unclamp. So down here, we are going to have the bag's full, and I am going to take, oh my gosh, this out, and I will make sure I don't touch anything with anything that I don't need to. Put it in here, and then I would get my, what in the heck is wrong with this thing? What have I done wrong? Okay, just pause for a second. It just was stuck. So now I'm gonna come in here, and I have collected enough. I'm gonna close it up, put my lid on, place it up here, label it, and then I'm gonna tuck this little pretty thing back up inside here, make sure there's no kinks, and that she's comfortable, that she understands everything that we've done, and clean up all my mess, and help her become comfortable again by covering her. I can remove all this stuff. I can take off my gloves. I'll tuck her back in, give her her call light, give her her phone, give her her iPad, give her whatever she needs, make sure that I have not left her environment messy, and let her know that if she needs anything, I'm just going to monitor for any changes in anything. After I've done this, I'll continuously check to make sure everything's running well. And now, Mrs. Alice, I think that was your name, and I look at her name badge again, I have been told by the doctor that I can take out your catheter. So I have knocked when I come back in, because this is a completely different time. I've knocked, I've introduced myself as your nurse Kristen, and I've checked on her band to see who she is. She's told me her name and her birth date, and I'm like, yeah, we're old friends by now, so we get to take out your catheter. She's like, what? I didn't even realize it was there anymore. So I'm like, okay, so this is not near as bad. As a matter of fact, you're not really even gonna tell. This is wash my hands. I will get her ready again, ask her to just get into this position again, because I would have put her back into a comfortable position before. But I would just tell her, okay, so we are going to put on my gloves. And I'm gonna take this little thing that does not have any water in it. I couldn't get any more of it in there before, if you're wondering why there's still some in there. And I am going to push it on here, and it's automatically going to just start filling up with all of that balloon water, or that water that I had put in her. It's going to just automatically start filling up. And if you want to double check to make sure you got it, you can pull that off and squirt it into the trash, put it back in, and just draw back to see, and you can see I got that much more that would not have been cool to make that balloon bigger. So I'm done with that, and I'm just gonna tell her, okay, slipping out, 1, 2, 3, and it's out, and I will make sure that I take care of this by not contaminating it with anything and putting it in the trash, which is this right now. You put that in the trash, or I would put it in a hazard bag just because it's been up in somebody's orifice. And then I would say, see, that wasn't even bad at all. And she's like, yeah, I'll be back next week for another. And cover her back up. She's comfortable. putting the blankets back on her, again checking for her everything, document everything again, tell any problems, any discomfort. I would ask her if she how she felt like it went, everything went, if she felt like everything was fine, and overall her idea of the whole process, as well as my assessments on anything that I have noticed as an abnormality. And then I would clean up and say goodbye.